For 6 months exactly now, the FDA has been requiring healthcare providers to tell patients if they have dense breast tissue. And if they do, a doctor recommends more screening than a mammogram. And this is the first full year all the supplemental screening options that may be suggested are actually available here.
Before, we would just say you have dense breast tissue, and this could decrease our ability to detect your cancer on mammograms, but there weren't any good options as far as what to do next. So now we want women to know, we know you have dense breast tissue, and here's what you can do about it.
Good morning, Shannon. How are you today?
2025 is the first year.
So I understand you're here for a breast screening ultrasound today.
Starting with all suggested enhanced screening options available in the Treasure Valley through both St. Luke's and Saint Alphonsus healthcare systems.
Our hope is by having all our modalities in one place, is a one-stop shop for patients and their doctors. It makes it easy for patients to get in, and we have everything available for them. 3D mammography, contrast enhanced mammography, pairing a mammogram with an IV of dye to increase detection chances. Giving contrast will help us highlight those cancers, they'll pop out. The most sensitive, abbreviated breast MRI. So it's less than 10 minutes. Rather than 45, tripling cancer detection.
This is your white, very fibrous breast tissue.
And automated breast ultrasound, or ABUS.
A little bit of pressure.
You know, I was kind of nervous that it might be painful because mammograms sometimes can be, but it wasn't at all.
It doubles cancer detection.
I'm grateful that we actually have this technology in our state. Usually Idaho is behind the times.
Increased breast density, which about 40% of women have.
So this is very fibrous breast tissue right here.
Makes cancer harder to detect.
Cancers show up as white, and it can hide in this glandular tissue here.
And research shows makes cancer 4 to 6 times more likely.
Being aware of all the different options that you have can help to catch a cancer at an earlier stage where we can treat it more successfully, have better outcomes, and also help people maintain their quality of life.
The growing knowledge of the FDA's new law requiring disclosure since September, propelling Idaho healthcare.
Now that we have patient support, patient interest, that's kind of what brought these to be able to come to fruition so that we can bring them to the Valley for women here.
Along with newcomers.
The Treasure Valley has a lot of people coming in from other states where there already had been breast density legislation, a little bit more awareness about breast density, and with people moving in, I think that's where kind of the awareness came from.
But these additions only benefit women who show up for regular recommended screenings starting at 40.
We're talking about all these supplemental examinations. However, nothing replaces a yearly mammogram. There are things that mammograms see that supplemental screening may not.
Which in Idaho, fewer women show up for than almost any other state.
Just getting women in our area in for a mammogram is a huge hurdle that we need to overcome.
Doctors blame this on rural living and lack of insurance coverage.
We have the mobile mammogram buses that go around, but they're not going to the middle of nowhere. So when patients come in to see me who have more advanced breast cancer, sometimes what they say is, well, I don't have insurance. So that's why I didn't go in for a mammogram.
And they call on legislators and insurers to help them save lives by easing access to these screenings.
We need insurances and laws to protect women and get them the imaging that they need.
And state lawmakers listening and most pushing for that same thing. The Idaho Senate Health and Welfare Committee holding a hearing on House Bill 134 just about an hour or so ago, and they're sending it to the Senate floor for full debate. Now, this bill requires health insurance plans to cover supplemental breast cancer screenings for women at high risk in hopes of early detection. The bill lists dense breast tissue as a risk factor, calling for this coverage. Representative Brooke Green at the helm amid her own battle with breast cancer, diagnosed last year, and she credits 3D mammography with saving her life.